So when I think of ICARE, I think of integrity, and I think of just how we should treat all our patients.
To be a person that has integrity, I also have a sense of pride with what I do and how I conduct myself. And I think that the majority of the people that I see, at least this is just my humble opinion, that work here have a great sense of pride in what they do.
That patient is someone's mother, someone's grandmother, someone's sister, someone's friend, father, grandfather, doesn't matter. And so you should just take the values that you cherish for your own self and just act upon those and treat your patients in the same manner.
When there's a need, somebody will say, okay, I can help with that.
But once you get here, you'll find what I was talking about, the compassion and the respect. And we try and truly treat you as though you were in a small community hospital. And our goal is to give that patient the best care that we possibly can.
Compassion is a big one. I tend to kind of go a little bit above and beyond with the families because they are very, very scared.
I have a duty, I guess maybe even an obligation, to do everything in my power in this role to look at how they're treated, look at how we interact with them, not just the patients, but the family members as well, and figure out how can we improve those interactions.
You have to give the patient the accountability of, here's what you can expect from us, and if we do not provide that, you are accountable for letting us know that we haven't reached your goal.
When someone comes to our hospital to visit a patient, or if they're here because they're sick, one of the biggest impressions they'll take home with them is how were they treated when they were here.
We cannot stop trying to make improvements every day at what we do and how we do it.
Respect is it's a mandate.
Respect goes a long way. Everything from working with your fellow employees to having respect for the patients and visitors.
We have to respect the elderly and the differences in all the people that we got coming in here. We have to understand it.
Respecting them, respecting their values, and respecting what they're due.
I want them to know that, hey, these people do care and they are going to help us whenever we couldn't find the help anywhere else, or they didn't have the excellence and the knowledge the other places that they had gone.
You really treat the sickest of the sick. People come here because we have the most experienced physicians, nurses, pharmacists, social workers, and
if you see your attending or your boss following, setting an example for integrity, compassion, all the things that ICARE represents, then in your formative years of training, such as being a resident, you are modeling that.
It's just doing the small things for patients that make the difference. Giving them a sandwich, giving them extra blankets, and just even sometimes taking the extra 5 minutes and listening to them, listening to their story, and just getting to know them as a person outside of just a patient.